The blood hit the floor before anyone reached for gloves. A four-star Navy admiral crashed through the emergency bay doors of Harmon Valley Medical Center in Augusta, Georgia, shrapnel in his chest, eyes wild, throwing off every hand that touched him. 6 doctors, 3 security guards, 2 orderlies, all of them backed against the wall while he knocked an IV pole across the room and screamed at the ceiling. Then she walked in. The nurse nobody respected, the one they called slow, nervous, not cut out for trauma. She crossed the room without hesitation, leaned down to his ear and said 4 words so quietly, nobody else heard them. The admiral stopped, completely, instantly, like someone had cut the power. He looked at her, really looked, and his whole body went still. That was the moment the room understood. The woman they'd been mocking all week wasn't afraid of the most dangerous man in the building. She already knew him. Before we go any further, if you're new here, hit that subscribe button right now and turn on notifications, because the story you're about to hear is only the beginning. We release new cinematic stories every week, and trust me, you do not want to miss what's coming. Drop a like if you're already hooked, and tell me in the comments, what city or country are you watching from? I read every single one, and I want to see exactly how far this story travels. Now, let's go back to Augusta and the nurse nobody saw coming. Her name was Nora Voss, and she had been at Harmon Valley Medical Center for exactly 9 days. 9 days was long enough to learn where the supply closets were, which attending physicians took their coffee black, and that the trauma bay had a ceiling tile that leaked every time it rained. It was also long enough to understand, without anyone having to say it directly, that she was not wanted there. It started on her second shift. Dr. Marcus Hale, the chief of emergency medicine, had watched her draw blood from a patient's arm, a clean, first-attempt stick on a difficult vein, and said, loudly enough for 2 nurses and a med student to hear, "Try not to dig around in there like you're looking for something you lost." Nobody laughed. But nobody said anything either, and that silence told Nora everything she needed to know about the culture of this place. She was 34 years old, 5'6", and she had what her mother used to call a forgettable face, the kind that didn't announce itself in a room. Brown hair she kept pulled back, eyes that were gray in certain light, green in others. She didn't wear makeup on shift because there was no point. She moved quietly through hallways and rarely spoke unless she had a clinical reason to. Her badge said, Nora Voss, RN, Trauma Care. And below her name, in the small photo, she looked exactly like what everyone assumed she was, an ordinary woman who had wandered into a hospital and hoped nobody would notice she didn't quite belong. Dr. Hale noticed. He made a point of it. On day 4, he'd questioned her charting in front of the entire nursing station. "This documentation is incomplete. How long have you been doing this?" When she said 5 years, he actually laughed, a short, dismissive exhale through his nose, and handed the chart back to her without another word. On day 6, he'd asked her to step out of a trauma room mid-procedure because, as he put it, "We need people in here who can move." She had stepped out. She had stood in the hallway with her hands at her sides and her face completely neutral, and she had not said a single word. Her charge nurse, Deborah Malloy, was different, not cruel exactly, but stretched thin and operating on the assumption that anyone knew was a liability until proven otherwise. "You're going to need to speed up," Deborah told her during the first week, not unkindly. "This isn't a learning floor. We don't have time to handhold." Nora had nodded and said she understood because she did understand, and because arguing the point would have taken energy she wasn't willing to spend. What nobody at Harmon Valley knew, what nobody was meant to know, was that Nora Voss had spent 11 years doing things in places that didn't appear on any map for an organization whose name wasn't spoken in hospital break rooms, and that the shaking hands Dr. Hale liked to mock weren't the result of inexperience. They were the result of something that had happened 22 months ago in a location she was legally prohibited from discussing, and they came and went depending on how much sleep she'd gotten and how much noise was in the room. She was managing them. She had been managing them for nearly 2 years. Augusta was supposed to be simple, small, manageable, the kind of place where a woman with a buried past could learn, again, how to be ordinary. That plan lasted exactly 9 days. Oh, the call came through at 11:47 p.m. on a Tuesday, and Nora was in the middle of restocking a crash cart when she heard the radio crackle at the nurse's station. The words that came through were fragmented: military transport, gunshot wound, critical, arriving in 4. And then the whole bay shifted into the particular kind of controlled urgency that trauma nurses learn to recognize the way sailors recognize weather. She finished restocking the cart, pushed it back into position, moved to the sink, and washed her hands. By the time the ambulance doors opened, there were 6 people already staged in the trauma bay. Hale, 2 residents, a respiratory tech, Deborah, and a nurse named Paul Gentry, who had 11 years in trauma and moved like he'd done this 10,000 times, because he had. Nora positioned herself at the edge of the bay near the secondary supply station, close enough to assist, far enough not to be in the way of people who didn't want her there. The paramedics came through fast. The man on the gurney was large, broad through the shoulders, probably 6'2", with an oxygen mask strapped crooked across his face and both wrists in soft restraints. His uniform had been cut open. There was blood across his chest and left shoulder, dark and dried at the edges, fresh and bright in the middle. His eyes were open and moving fast, tracking the ceiling lights as they passed, and his jaw was clenched so tight Nora could see the muscle jumping in his cheek from across the room. "GSW, left chest, through and through," the lead paramedic called out, transferring report as they moved. "Possible shrapnel secondary injury. BP 84 over 60 on scene, holding at 91 now. He's been combative since we loaded him. Took out my partner's radio. Restraints were necessary." "Who is he?" Hale asked. The paramedic glanced at the security officer who had come in behind the gurney, a man in a dark suit who was not hospital security, who had the particular posture of someone trained to stand in doorways and assess rooms, and said, "His ID is above my clearance level. You'll be getting a call." Hale didn't like that answer. You could see it in the set of his jaw. But he moved to the gurney and began his assessment, and everyone else moved with him, and for 40 seconds it looked like this was going to be a standard critical trauma, controlled, procedural, everyone doing their job. Then the Admiral woke up. There was no gradual return. His eyes, which had been unfocused and glassy, suddenly sharpened with a violence that was almost physical. He pulled against the restraints, not panicking, but purposeful, like someone who had been restrained before and knew exactly how much force to use. His right arm came partially free. He got a hand around Hale's wrist before anyone could react and squeezed hard enough that Hale made a sound and stepped back. And then the Admiral was trying to sit up, and there were 4 people trying to hold him down and failing because the man was not confused. He was tactical, moving with precision, protecting something even if he didn't know exactly what. "Sir, you need to... Get your hands off me." His voice was rough and damaged from whatever had happened to him, but the command in it was completely intact. "I don't know any of you. I don't know where I am. Get your hands off me right now." "You're in a hospital," Hale said, moving back to the gurney with both hands raised. "You've been shot. We need to..." The Admiral grabbed the IV line someone had started in his right arm and yanked it free. Blood tracked across the sheet. He was breathing hard and sweating through his hospital gown, and his eyes were going around the room fast, cataloging exits and faces. And Nora recognized that look. She had worn that look herself, in a field hospital, in a place she wasn't supposed to be, when she came out of anesthesia not knowing if the people around her were trying to help her or waiting for her to be weak enough to finish. She was already moving before she decided to move. "Dr. Hale." Her voice was quiet, not loud enough to startle anyone. "Let me try." Hale turned around. His expression made it clear that of all the things he needed right now, her input was not among them. "Voss, get back to..." 30 seconds, she said. "Give me 30 seconds." Something in her tone, not volume, not aggression, just a flatness that didn't leave room for argument, made him stop. He looked at her for a moment. Then he stepped back from the gurney and made a gesture that was half dismissal, half surrender. Nora walked to the side of the gurney. The Admiral tracked her. His right hand was still partially free, and he had it raised in a way that was not aggressive, but was not relaxed either. His chest was moving in short, controlled pulls. The wound was bleeding again where he'd moved, dark red soaking through the temporary dressing. She didn't reach for him. She didn't make any movement toward his body at all. She leaned forward slightly and said, very quietly, close enough that her voice wouldn't carry past the edge of the gurney, "Red line, November 7. The room heard nothing, or they heard sounds that didn't make meaning. The Admiral heard the words exactly as they were intended. His hand dropped, not slowly, not gradually. It dropped like the tension left his body all at once, like a string had been cut, and he looked at her with an expression that was not confusion. It was recognition, sharp and disoriented, the face of a man who had just heard something that couldn't be here, in this place, coming from this person. "Who are you?" he said. Just that, low enough that only she could hear. "Someone who's going to make sure you don't die tonight," she said. "Can you lie still while we do that?" He studied her face for 3 long seconds. Then he lay back against the gurney and closed his eyes. The silence in the bay lasted about 4 seconds. Then everyone started moving again, the way people resume motion after something unexpected passes, collectively deciding not to examine it too closely because there was work to do. Hale stepped back to the gurney with the particular tight-jawed focus of a man reclaiming authority over a situation that had briefly slipped from him. The residents repositioned. Paul Gentry started a new IV line with smooth efficiency. Nora moved to the secondary position she'd been in before and stayed there, hands available, face neutral. But Hale was watching her now. She felt it the way you feel surveillance you weren't expecting, a shift in the quality of attention in the room, directed and specific. She kept her eyes on the patient and her movements deliberate, giving him nothing to object to. The Admiral's name, they learned through the suited man in the doorway, whose call came through to Hale's cell phone approximately 90 seconds after the Admiral went calm, was Raymond Alcott. 4 stars. 40 years of service. Currently listed, for reasons the man in the doorway declined to specify, as traveling on personal business in a domestic capacity. No press, no official notifications. Any breach of patient privacy would be handled at a federal level, and the man said this the way people say things when they want you to understand that federal is not a figure of speech. Hale absorbed this, nodded, turned back to his patient with the particular expression of a man who had just been handed something he didn't ask for. The surgery that followed was not in the trauma bay. Alcott's chest wound required an OR, shrapnel removal, repair of a nicked vessel that had been bleeding slowly for what the surgical team later estimated was 6 to 8 hours. He went up to the OR at 12:23 a.m. The bay cleared. The suited man positioned himself outside the elevator bank. By 1:30 in the morning, Nora was finishing her documentation at a corner workstation when Hale appeared beside her. She didn't look up immediately. She finished the sentence she was typing. Then she looked up. "Where did you serve?" he said. "I'm sorry?" "Don't do that." His voice was quiet, but there was nothing soft in it. "That phrase you used, that's not nursing school. That's not 5 years in a trauma bay in wherever you came from. Where did you serve?" She looked at him steadily. "I don't know what you're talking about, Dr. Hale." "That man has been combative with EMS since they picked him up. He fought off 2 paramedics and a security officer. You walked up and said something to him, and he shut down completely." He paused. "I want to know what that was." "He was exhausted and in pain," she said. "Sometimes people just need someone to approach them without panic." Hale looked at her for a long moment. She could see him deciding whether to push it, calculating the cost of what came next. He was not a stupid man. That was the problem with him. He wasn't stupid, he was simply certain. And certainty in people with authority has a tendency to harden into something that stops accepting new information. "I'm going to need a full account of that interaction," he said finally, in writing, before end of shift. "Of course," she said. He walked away. She turned back to her screen. Her hands were not shaking. That surprised her. Admiral Alcott came out of surgery at 4:15 a.m. and was moved to the surgical ICU on the 3rd floor. The suited man, who had identified himself to hospital administration only as Federal Liaison, last name Mercer, remained on the floor. A second man arrived at approximately 5 a.m. and positioned himself at the stairwell door. Nora learned this from Paul Gentry, who learned it from the night charge, who had heard it from the surgical nurse who'd scrubbed in. The hospital had a particular ecosystem of information, not gossip exactly, but the movement of relevant data through a staff who understood that knowing things quickly was sometimes the difference between a patient being safe and a patient not being safe. She was assigned to a different patient for the remainder of her shift. A 47-year-old with an allergic reaction, a college student with a fractured wrist, 2 chest pains that turned out to be anxiety. She worked through them with the same deliberate focus she brought to everything, thorough without being slow, careful without being tentative. At 6:45 a.m., Deborah Malloy found her in the break room with 15 minutes left in her shift. "Hale wants to see you before you go," Deborah said. She was looking at Nora with an expression Nora had not seen on her face before. Not hostile, but wary. Careful. The way people look at something they've just reclassified. "Okay," Nora said. "What happened down there?" Deborah asked. Not accusatory, just direct. "I talked to a frightened patient," Nora said. "It worked." Deborah looked at her for another second. Then she nodded and left. The meeting with Hale was brief and precise, the way a blade is precise. He had security logs, he said. He had documentation of an unauthorized interaction with a restricted patient. He had, he said, concerns about her background, her references, her employment history, certain gaps that HR had flagged on intake but that had been overlooked because they were short-staffed and needed to fill the position. He was suspending her pending investigation. "You can't be serious," Nora said. "Pending review of your credentials and a full account of your interaction with the patient, you're not to report for shifts. You'll surrender your badge." She looked at him. She took a breath. She considered briefly what it would cost her to say the things she was actually thinking. "This is a mistake," she said. "That's your opinion," he said. She surrendered her badge. She rode the elevator down to the lobby with her bag over her shoulder and her face completely still, and she walked through the automatic doors into the gray pre-dawn of Augusta, and she stood on the sidewalk for a moment in the thin October air. She had a prepaid phone in her bag. She had 3 numbers memorized that she'd never dialed since coming to the city. She had a protocol for situations that moved past manageable, and she had known, in some quiet backroom part of herself, that there was a reason she hadn't unpacked all her boxes yet. She did not make the call. Not yet. She walked to her car. She sat. She watched the hospital entrance. At 7:22 a.m., her personal cell phone, the one with her actual name attached to it, the one almost nobody had the number for, rang with a number she didn't recognize. She answered it. "Voss?" A man's voice, controlled, low. She didn't know it. "This is Deputy Director Farron, Naval Intelligence. We have a problem with your patient." She stared through the windshield at the glass front of the hospital. "Tell me," she said. "Someone on that floor isn't who they say they are," Farron said, "and Alcott is in no condition to protect himself." She was already opening the car door. "How long ago?" she said. "The breach was flagged 4 minutes ago." She moved across the parking lot at a pace that was not quite running but was not walking either. The particular gait of someone who has learned to cover ground fast without drawing attention, and she pushed through the lobby doors with her badge already gone and no way to badge through the security door, and she went to the desk where the overnight receptionist was still on shift, and she said, quietly and without hesitation, "There is a man on the 3rd floor who is going to die if I don't get up there in the next 3 minutes. Call your security supervisor and tell them Deputy Director Farron of Naval Intelligence authorized my access. Right now, please." The receptionist looked at her, then picked up the phone. The receptionist's phone call bought her 90 seconds. That was enough. The overnight security supervisor, a heavy-set man named Briggs who moved faster than his build suggested, met her at the stairwell door with a temporary access card and a look on his face that said he didn't understand what was happening but had decided not to wait until he did. Nora took the stairs 2 at a time, not running, just moving with the kind of controlled urgency that doesn't announce itself as panic. 3rd floor, surgical ICU. She knew the layout from her orientation tour 9 days ago, had memorized it the way she memorized every building she entered. Not from habit exactly, but from something older than habit, something that had been trained into her until it became automatic. The stairwell door opened onto a corridor that smelled of antiseptic and recycled air. She came through it and immediately registered what was wrong. Mercer, the suited federal liaison who had been stationed outside the elevator bank all night, was not at his post. The second man, the one who'd arrived at 5 a.m. and taken the stairwell door, was also gone. Both of them. At the same time. She didn't break stride. She turned left toward the SICU entrance, pushed through the double doors with the temporary card Briggs had given her, and moved down the unit corridor with her eyes going to every doorway, every face, every small wrong thing. There were 3 nurses on the overnight SICU shift. One was at the central station, head down over a chart. One was in a patient room at the far end of the corridor. The third, she counted the staff she'd been told were on this floor. The third should have been visible from where she was standing, and wasn't. Alcott's room was the 4th on the left. The door was mostly closed, a 6-inch gap, dim light inside. She was 4 steps away when she heard the monitor alarm begin, not the steady beep of normal monitoring, the flat, escalating tone of a rhythm in collapse. She hit the door with her shoulder and went in fast. The man beside the bed was not a nurse she recognized. He was wearing scrubs, the right color, the right cut, and he had a syringe in his right hand and his left hand was on the IV line feeding into Alcott's central line port. And he was in the process of depressing the plunger when Nora crossed the room in 3 steps and hit his wrist with the blade of her hand hard enough that the syringe skittered across the floor, and the man spun toward her with a speed that confirmed instantly and completely that he was not a medical professional who had made a terrible error. He came at her with his elbow first. She wasn't where his elbow expected her to be. What happened in the next 11 seconds was not graceful. It was not the kind of thing that looks clean from the outside. She took a hit to her left shoulder that would leave a bruise the size of a fist. She got her forearm across his throat and drove him back into the wall with her body weight behind it, and when he tried to bring his knee up, she shifted her hip and took it on her thigh instead, and then she had his right wrist locked in a position that made further movement a choice between compliance and fracture. He chose compliance. She held him against the wall with one hand and reached for the call button with the other, and pressed it, and kept pressing it, while she watched Alcott's monitor with her peripheral vision and counted the seconds until someone came. It took 47 seconds. They felt considerably longer. The night charge nurse was a woman named Sandra Obi, 12 years in critical care, and she came through the door at a controlled run and stopped when she saw the scene. A suspended nurse with no badge holding a man in scrubs against the wall, an admiral in full cardiac distress on the bed, a syringe on the floor. "Get him," Nora said, and her voice was steady, which surprised her. "He's not staff, and I need someone on that monitor right now. His rhythm is—" "I see it." Sandra was already moving to the bed. She had the presence of mind not to touch the IV line until she knew what had been in the syringe. What did he push? "I don't know. I don't think much got in. Maybe nothing." She tightened her grip on the man's wrist as he shifted. "I need restraints, and I need security, and I need someone to bag that syringe off the floor for a talk screen." "You don't work here," Sandra said, but she was pulling her radio with her free hand and calling it in at the same time, which told Nora everything she needed to know about Sandra Obi. Hospital security arrived in under 2 minutes. Mercer arrived 30 seconds after that, breathing hard, a cut above his left ear that he hadn't noticed yet, his suit jacket gone. And when he saw the man Nora was holding, something shifted in his expression that was not surprise but was close to relief, the specific relief of someone who has been looking for a thing and found it somewhere worse than they expected. "That's him," Mercer said. "I know," Nora said. She released her hold, let security take over, stepped back and put her hands at her sides and became deliberately someone standing in a corner while other people worked. Her shoulder hurt. She rotated it once, quietly, and stopped. Alcott's rhythm was coming back. Sandra had it. She was good, fast, calling out the changes as they happened and adjusting without waiting to be told. The code team arrived at the door, took in the situation, and Sandra waved them in with the particular authority of someone who has run a unit long enough that no one questions her in a crisis. Nora stayed out of the way and watched and calculated. The man in the fake scrubs was on the floor with 2 security guards on him, and he was not speaking, not struggling, looking at the ceiling with the calm, closed face of someone who had been trained to be caught and knew exactly how to behave when it happened. That was its own kind of information. By the time dawn finished arriving, the 3rd floor of Harmon Valley Medical Center had 4 federal agents on it, a hospital administrator who had been called in from home and was still in the wrong shoes, and Marcus Hale, who appeared at 7:58 a.m. in his street clothes with his hospital ID clipped to his jacket pocket, and an expression that suggested he had received a phone call he hadn't expected and driven here without fully processing it. He found Nora in the family waiting area at the end of the SICU corridor, sitting in a chair with her bag at her feet and a cup of vending machine coffee she hadn't touched. He stood in the doorway for a moment. Then he came in and sat down 2 chairs away from her, which was not close but was not the opposite end of the room either, and for a few seconds neither of them said anything. "They told me what happened," he said. She didn't respond. "You stopped." He paused, reorganized. "The man in the room. You physically—" "Yes." Another pause. She could see him trying to fit this into the model he'd built of her over 9 days, and the model not accommodating it, and him not quite ready to rebuild the model yet. "Your badge," he said. "You have it." "I'm aware." He looked at his hands. "I'm going to need you to explain to me what's happening." "No," she said. "You're not." He looked up. "There are federal agents on your floor," she said. "They're going to explain things to you. I'm not authorized to, and honestly, Dr. Hale, even if I were, I don't think this is the conversation that needs to happen right now." She finally picked up the coffee, took a sip. It was bad. "Right now you need to go make sure your patient is stable and let the people whose job this is do their jobs." He stared at her. "You were suspended," he said. Not accusatory, more like he was checking whether that fact still made sense. "I know." "You came back in anyway." "Yes." He didn't say anything else for a moment. Then he stood up, straightened his jacket, looked at her the way you look at something when you realize you've been using the wrong category for it. "The suspension is on hold pending. It doesn't matter right now," she said. He left. She sat in the waiting room and drank the bad coffee and did not let herself think too far ahead. Deputy Director Farron arrived in person at 9:30 a.m. He was shorter than his voice, compact, 60-ish, silver-haired, with a face that had spent a long time arranging itself into the expression of a man who didn't give away what he was thinking. He came with 2 people she didn't know, and a third she recognized from a different life. And when he walked into the consultation room where she'd been moved, a small space with a table and 4 chairs and a window that looked onto the parking garage, he closed the door and sat across from her and looked at her for a long moment without speaking. "Nora," he said finally. "Sir?" "You look tired." "I'm fine." "I didn't ask if you were fine." He put a folder on the table but didn't open it. "I asked if you were tired." She looked at him. "Yes, I'm tired." He nodded like that was the right answer. "How long have you been in Augusta?" 9 days. "And you've been working trauma?" "Yes." "Under a civilian identity." That was the arrangement. He opened the folder then. She didn't look at it. She already knew what was in it, or she knew what wasn't, which amounted to the same thing. "The man you apprehended," Farron said, "is a contractor. His real name doesn't matter right now. What matters is who hired him and why. And you've already figured out enough of that to know this isn't a simple situation." "Alcott was the target," she said, "not a random one. Someone wanted him specifically, knew his location, knew enough to get a person onto that floor in scrubs without triggering any of your people until it was almost too late. That's not a contractor job, that's a directed operation, and the direction came from somewhere with access to his medical transport information." Farron looked at her without expression. "Go on." "Which means internal," she said. "Someone in your chain of command or close to it." "That's a significant accusation." "I'm not accusing anyone," she said. "I'm describing what the evidence suggests. You can disagree with my read." He didn't disagree. He turned a page in the folder and pushed it across the table to her. She looked at it. It was an organizational chart. Several names were redacted. 3 were not. She studied it for 30 seconds. Then she pushed it back. "How long have you known?" she said. "We've had suspicions," he said carefully. "Admiral Alcott was in the process of documenting something. We don't know the full scope yet. His injury wasn't accidental. There are indicators suggesting it was staged to look like an assault during a routine security matter, which means someone moved against him before he could finish what he was building." And you need him alive to find out what that is. We need him alive for several reasons. He paused. One of them is that he specifically asked for you. She went very still. Before surgery, Farron said, he was conscious long enough to say your name, your real name. He watched her face. That created some complications for your cover situation. I imagine, she said. Do you want to tell me how he knows you? No, she said. He almost smiled, not quite. That's what I thought. He closed the folder. Here's where we are. You're blown, not publicly, but within certain circles, yes. Your placement here is compromised. The question is what we do with that. What are the options? Option 1, we extract you. New placement, different city, different name. The work you've been doing here ends. She waited. Option 2, he said. You stay, openly. Not as Nora Voss, civilian trauma nurse on suspension. As yourself. That's not an option, she said. My status... Your status is currently under review, he said. Has been for several weeks, actually. There are people who've been arguing for an active reinstatement. She looked at him. Alcott is one of them, he said simply. The room was quiet for a moment. Outside, through the window, she could see a gray sedan pulling into the parking garage, and she watched it without really seeing it. And she thought about what reinstatement meant and what it would cost, and whether she was ready for what it would cost, and decided that readiness was probably not the point. What do you need from me right now? She said. Stay close to Alcott, Farron said. He trusts you, and right now you're the only person on this floor we're completely certain about. She looked at him. That's not a small thing to say, she said. No, he agreed. It isn't. Hale reinstated her badge at 10:15 a.m. without an announcement or an apology, just a temporary credential left at the nursing station with her name on it and a note that said cleared to return to duties, third floor assignment, effective immediately. Deborah Malloy handed it to her without comment, but held eye contact for a second longer than necessary, which from Deborah was approximately the equivalent of a lengthy speech. Paul Gentry, passing her in the corridor with a rack of IV supplies, said, Heard you had a busy night. Little bit, she said. You good? Getting there. He nodded and kept moving, and that was the entirety of the conversation, and somehow it was the most normal thing that had happened to her in 36 hours. She took her post outside Alcott's room at 10:30. Mercer, cleaned up now, the cut above his ear butterfly taped, briefed her on the security configuration that had been rearranged since the breach. 2 agents outside the room at all times, 1 in the corridor. No one entered without verbal clearance from Mercer or from her. From me, she said. Those are the deputy director's instructions, Mercer said. She absorbed that. Alcott was conscious when she went in at 11 a.m. for his first post-surgical nursing check. He was pale in the way that people are pale after significant blood loss, with the particular drawn quality around the eyes that comes from pain medication doing its job imperfectly. He had an oxygen cannula and 2 drains and a chest dressing that someone had placed very neatly, and his hands were at his sides and he was looking at the ceiling when she came in, but he turned his head when he heard the door. He looked at her for a moment. You're still here, he said. For now, she said. She moved to the pump to check his drip rates. He watched her work. They told me what you did, he said. They shouldn't have. Voss. That's not my... She stopped. Let it go. I did my job. That's not what it looked like from the outside. Then the outside had an incomplete view. She checked the second drain. How's your pain on a scale of 1 to 10? 4. She looked at him. 6, he said. I'll adjust the pump. She did. You need to rest. Whatever conversation Farron thinks we're going to have today needs to wait. Farron can wait, Alcott said. I've been making Farron wait for 15 years. That's not what I want to talk about. She finished her check, pulled up the chair that lived in the corner of every ICU room, the one families used during long vigils, and sat down because standing over a supine patient felt wrong for this particular conversation. Okay, she said. He looked at the ceiling again. When he spoke, his voice was careful, not emotional exactly, but aware of the weight of what he was saying, placing each word like someone navigating something they'd broken before. "I read your debrief," he said. "The one from Kandahar." She said nothing. "All of it," he said, "including the sections that most people with my clearance level skip because the operational details are—" He stopped. "I read it." "I know you did," she said. "I was told. And I read the supplemental review that said what happened wasn't your fault. The supplemental review was written by people who weren't there." "I know that too." He turned his head to look at her. "Does it matter to you what the review said?" She thought about that honestly. "Some days?" He nodded. Like that was enough of an answer. "I put your name in for reinstatement 8 months ago. Farron told me you'd been placed, that you were—" He searched for the word. "Recuperating." I didn't know where. When they told me where they were transporting me, I didn't make the connection until I was already— He gestured vaguely at his own condition. "It's fine," she said. "It's not fine. Your cover—" "It was already thin," she said. "Civilian identity in a trauma bay. Sooner or later, someone was going to ask a question I couldn't answer." She paused. "As it turned out, someone tried to kill you instead, so the cover question is relatively low priority." Something moved across his face that might have been the beginning of a smile if he'd had the energy for it. "The man they arrested," he said. "Did he say anything?" "Not to me." "Did you get a look at him? Up close?" "Yes." "Do you recognize him?" She had been waiting for this question, actually. Had been turning it over since the moment security pulled the man off the floor, and she'd had 2 seconds to look at his face clearly. "No," she said. "But he's trained. The way he went still when it was over, that's not a street contractor. Someone spent real money on him." Alcott's expression didn't change, but something shifted behind it. "That matches what I've been finding," he said. "What have you been finding?" He looked at her for a moment, decided something. 3 operators. All listed KIA in separate incidents over 18 months. All of them were on operations that ran through a specific logistics chain. He paused to breathe. The movement of talking was costing him something. "The chain traces back to a set of accounts. The accounts trace back to authorizations that shouldn't have existed." "Whose authorizations?" He was quiet for a moment. "That's what someone doesn't want me to finish documenting," he said. She sat with that. "Where's the documentation?" she said. "Encrypted, distributed, safe." He closed his eyes briefly. "For now." Alcott. "Sleep," she said. "We'll do the rest of this later." "You'll stay?" "I'll be outside," she said. He didn't answer, which meant he was already most of the way under, and she sat for another minute just listening to the rhythm of his monitors, which was steady now, which was what she needed it to be. She stood up, pushed the chair back to its corner. At the door she paused, looked back at him, at the gray in his hair that hadn't been there in the photograph she'd seen of him years ago, at the lines around his eyes, at the way his hands lay open on the blanket, older than they should be. 40 years. 4 stars. And someone had decided he needed to disappear before he could finish writing down what he'd found. She went out, took her position in the corridor. What? The problem with Nora's shoulder, the one she'd taken the hit to during the struggle, announced itself properly at around 2 p.m., when she raised her arm to reach a supply shelf and felt something pull in a way that made her teeth come together. She stood still for a moment, rotated slowly, not dislocated, soft tissue. She'd live. She was taping it herself in the supply room, awkwardly, when Sandra Obi appeared in the doorway. "You know I can do that," Sandra said. "I've got it." "You clearly don't." Sandra came in anyway, took the tape from her hand with the brisk authority of someone who has dealt with patients who insist they're fine while obviously not being fine. She worked quickly and without ceremony. "How long were you in the military?" Nora looked at her. "I'm not asking for details," Sandra said. "I'm just— the way you move, and what you did in that room, that's not civilian trauma training." "I had some additional background," Nora said. Sandra finished the tape job. "Is Alcott going to be safe here?" "That's the goal." "That's not the same as yes." Nora looked at her. Sandra looked back. She had the kind of directness that came from years of watching people dance around difficult things in ICU waiting rooms, and she had apparently decided there was no point in applying that dance here. "We're working on it," Nora said. "Okay," Sandra said. "If you need anything on my unit, ask me. Not Hale, not administration." She picked up the roll of tape. "Me." She left. Nora stood in the supply room for a moment and thought about trust, how quickly it could shift when circumstances forced an update, and how rare it was for people to make that update honestly instead of reluctantly. Sandra Obi had done it in approximately 12 hours. Hale was still somewhere in the middle, caught between what he'd believed about her and what he'd seen, not yet committed to either. She went back to her post. What? At 4:47 p.m., Mercer appeared at her side with his phone face down in his hand and an expression she'd learned to read over the last several hours. Controlled, but pushed. "Farron needs you," he said. "Now." She followed him to the consultation room. Farron was at the table. His two people were at the wall. The third person, the one she'd recognized from a different life, a woman named Sloan who worked analysis and didn't do field work unless something had gone badly enough that field work was necessary, was standing at the window looking at the parking garage with her arms crossed. "Sit down," Farron said. She sat. "The contractor," Farron said. "He's talking." "To your people?" "To whoever he can get to listen." He looked at her. "He gave them your name, your real name, and he described your involvement in a classified operation in detail that he should not have access to." The room was very still. "He's suggesting," Farron continued carefully, "that you were not stopping him tonight, that you were part of the original operation, and that the struggle he described to our agents was staged, that you were positioned in this hospital to ensure the job got done with enough deniability that—" "That's absurd," she said. "I know that," Farron said. "Then why are you telling me?" "Because it's going to be investigated," he said. "Protocol. There are people in this building right now, federal agents who don't know you, who only know what this man has said. And until we can definitively close this out, your access to Alcott is going to be questioned." She felt something shift in her chest. Not fear, something colder than fear. "He's doing it deliberately," she said. "Whoever sent him, they knew that if he got caught, the fallback was to implicate the one person on this floor Alcott trusts. Take me out of the picture through the investigation, try again when the security is reconfigured without me factored in." Farron looked at her. "Yes," he said. "That's what we believe too." "So what are you doing about it?" "We're working to verify your account." Mercer's statement, Sandra Obi's statement, the talk screen on the syringe. He paused. "But it takes time, Nora, and in the meantime—" The door opened. Not Mercer. A man she hadn't seen before, younger, dark jacket, the specific way of moving that meant federal agent before he opened his mouth. "Deputy Director." He looked at Farron, not at her. "We have a problem on the third floor." Farron stood. "Alcott?" Nora said. "His monitors went offline 4 minutes ago," the agent said. "All of them, simultaneously. The backup system should have—" She was already out of her chair. She was through the door before anyone told her she could be, moving down the corridor toward the stairwell at a pace that didn't ask permission, and behind her she could hear Farron's voice calling something and footsteps following. And above her, 3 floors up, Raymond Alcott was alone in a room with no monitors, and 2 agents outside the door who were about to discover that the threat they'd been watching for was already inside. She hit the stairwell door at a run. 3 flights. She took them the way she'd been taught a long time ago in a building that no longer existed, in a program that officially never ran. Hand on the rail only to redirect momentum, not to slow down, footfalls close to the inside edge where the steps were shortest. 12 seconds to the 3rd floor. Maybe 13. The door opened onto the SICU corridor, and she saw immediately that the 2 agents who were supposed to be outside Alcott's room were not outside Alcott's room. One was 20 feet down the corridor, radio to his ear, moving toward the nursing station. The other was standing at the door to the electrical room, hand on the frame, looking in at something she couldn't see from this angle. Sandra Obi was at the central station, and she looked up when Nora came through the stairwell door, and the expression on her face was not panic, but it was close. The controlled, high-alert look of someone who has realized that the problem is larger than the information she currently has. "His telemetry dropped," Sandra said. "All of it. I sent someone in." "Who?" Nora was already moving to Alcott's door. Torres. She went in 2 minutes ago. She hasn't come back out. Nora pushed the door open. The room was not dark. The overhead fluorescents were on, harsh and flat, but it felt wrong in the way that rooms feel wrong when the familiar background noise of medical equipment is absent. The pump was silent. The monitor screen was black. The backup battery indicator was dark, which meant someone had physically disconnected it, which meant this was not a power failure. Torres, a SICU nurse, mid-20s, someone Nora had passed in the corridor twice but never formally met, was against the far wall, standing, hands at her sides, alive clearly, breathing but very still, with the specific stillness of someone being kept still by a choice they've been offered. The man beside her was not large. That was the first thing. Medium height, lean, wearing the same style of scrubs as the one from last night. And that was where the similarity ended, because this man was not holding a syringe and he was not going for an IV line. He had his left hand on Torres' shoulder in a way that looked almost casual, and he had his right hand. Alcott was in the bed, conscious, not moving. His eyes went to Nora the moment she came through the door, and they stayed there with the focused intensity of a man communicating without speaking. And what she read in them was not fear, it was information. He was trying to tell her something. She didn't look at him long enough to read it fully, because the man with the casual hand on Torres' shoulder had turned toward her and she needed to track his right hand. "Close the door," the man said. His voice was flat. Regional accent she couldn't immediately place. He spoke like someone who had made a decision before she walked in and wasn't revising it. She stepped inside, let the door swing shut behind her. Did not close it all the way, left a 2-inch gap that he might not notice if he wasn't specifically looking for it. "Okay," she said, "hands where I can see them." She raised them to shoulder height, palms out, the universal language. "You're the nurse," he said, "the one from last night." "Yes. He told me about you." He meant the contractor from the night before, the one in custody, the one who'd been talking. "Said you were fast." "He was being generous," she said. His right hand moved slightly. She saw it then, not a weapon she recognized at a distance, but the silhouette was wrong for a firearm, too compact, and he was holding it against his thigh at an angle that suggested he wanted her to know it was there without letting Torres see it clearly. That told her something about his priorities, which told her something about his training. "I need 5 minutes with him," the man said. "You're going to stand there, the nurse is going to stand here, and in 5 minutes I'm going to leave and nobody gets hurt." "That's not a thing I'm going to let happen," Nora said. "You don't have a lot of leverage right now." "Neither do you." She kept her voice level. Not aggressive, not placating, just factual. The tone you use when you want someone to hear the information and not the emotion. "There are federal agents 1 floor below me right now who know exactly which room I ran to. In about 90 seconds, this corridor is going to have more people in it than you can manage. So whatever you think you're going to do in 5 minutes, you don't have 5 minutes." He looked at her. She looked back. Torres, against the wall, was breathing in short, controlled pulls. Scared, but not frozen. Her eyes were moving. Nora caught that and filed it. "Step away from him," Nora said. To the man. "Quiet. Step away from the bed and put whatever that is on the floor, and I will personally make sure that what happens next is a conversation and not the other thing." "You're a nurse," he said. "Among other things," she said. He had about 2 more seconds of decision-making left in him. She could see it in the set of his jaw, the small recalculation happening behind his eyes. And she used those 2 seconds to shift her weight almost imperceptibly to her right foot and angle her left shoulder back, which changed nothing visible from more than 6 feet away, but meant that when he moved, she was already in a different position than he thought she was. He moved. Not toward her, toward Alcott. She crossed the room in the time it took him to take 2 steps, and she came in from his left side, the side Torres wasn't on, and got her forearm across his right arm just below the elbow, forcing it outward and away from the bed. And the thing in his hand discharged against the wall with a sound like a sharp crack and not a gunshot, which meant it was exactly what she'd thought. A directed charge device, designed for a specific kind of targeted disruption that she didn't have time to think through right now. Torres moved. To her credit, she moved toward the door and not away from it, and she hit the corridor already calling out, and Nora heard footsteps from the hall almost immediately. The man tried to bring his right arm back. She didn't let him. She drove him into the equipment cart beside Alcott's bed, and the cart went over and the crash was loud in the silent room, and she had his wrist locked and her elbow across the back of his neck and his face against the linoleum, and she was aware that her taped shoulder was screaming at her in a way that suggested Sandra's tape job was the only thing currently holding the situation together. "Don't," she said, into the back of his head, flat. He stopped. The door came open hard. 2 agents, Mercer behind them, the youngest one with his hand already on his weapon and not drawing it, which was the correct call, and Mercer behind him reading the room in about a second and a half and pointing at the man on the floor and saying, "Secure him," without any additional theater. They pulled him off the floor. She let go, stepped back. Her shoulder informed her with considerable emphasis that it had done everything it was going to do tonight. She turned to the bed. Alcott. He was looking at her. His chest was moving too fast. Not arresting, not crashing, but elevated, the body's honest response to having someone come at him while he was flat on his back and attached to lines he couldn't move away from. The chest dressing was intact, both drains in place. The IV had been jostled, but not pulled. "Still here," he said. "Still here," she confirmed. "The device," he said, "against the wall." "I know." "It was for the pacemaker leads," he said, "from a distance. Make it look like cardiac failure." She turned and looked at the wall where the device had discharged. The mark was about 18 inches above the floor, which was wrong for the angle that would reach his chest from the bed. He'd moved, she realized. At some point while she was crossing the room, he'd shifted himself lower in the bed. Not much, maybe 4 inches, and that shift had been enough. He'd done that deliberately. "That was you," she said. "I had about half a second," he said. "Hurt like hell." She looked at him for a moment. "You moved a surgical drain doing that." "I know." "It needs to be checked." "I know that too." He held her gaze. "Thank you." "Don't thank me," she said. "Breathe normally and let me check your drain." Farron arrived 60 seconds later and the room became very crowded very quickly, which was the opposite of what Alcott needed, and Nora said so in terms that were not quite as diplomatic as she'd have managed on more sleep. Sandra appeared in the doorway and immediately began the quiet, immovable process of reclaiming the room as a medical space rather than a staging area, which was one of the things that made Sandra Obi very good at what she did. The second contractor, because that was what he was, the second one in less than 24 hours, which meant the operation was resourced and didn't intend to stop, was taken to a room on a different floor with considerably more security than had been applied to the first. Nora heard, through Mercer, that the first contractor's narrative had been partially dismantled by the talk screen on the syringe, which had come back as potassium chloride at a concentration that did not occur naturally and was not part of any medication protocol in Alcott's chart. That was the kind of evidence that made certain allegations much more difficult to sustain. She processed this standing in the corridor outside Alcott's room, with her back against the wall and both hands at her sides, while the controlled chaos of a second security breach reorganized itself around her. Her shoulder had settled into a deep, persistent ache that she was managing by not moving it unnecessarily and by not thinking about it when she could help it. Hale appeared at 6:10 p.m. He came through the SICU doors in his white coat. He'd gone home and come back, she gathered, or possibly never left. And he walked toward her with the deliberate pace of a man who had made a decision and was now executing it. He stopped in front of her. He looked at her shoulder in the particular way that physicians look at things they've diagnosed from 6 feet away. "That needs imaging," he said. "It's soft tissue. You're not qualified to make that determination about yourself." "I've had worse, and I know what worse feels like," she said. "It's soft tissue." He held her gaze for a moment. Then, slowly, with visible effort, "You saved him, twice, in less than 24 hours. She said nothing. "I need to understand," he said, "what I'm dealing with here. Who I have on my staff." He paused. "Or who I thought I had on my staff." "That's a conversation for a different time," she said. "When?" When there aren't active threats to a patient on your floor. He looked at her, looked at the door to Alcott's room, looked back. Is there anything you need? He said. The question came out slightly stiff, like something he'd practiced saying and wasn't entirely comfortable with yet. Access to my patient, she said, without interference. You have it, he said. He left. Farron found her at 7 p.m. after the floor had settled into something resembling controlled stability. More agents, repositioned, with a protocol that had been rebuilt from the ground up in the last 2 hours. He came with Sloane, who had the look of someone who had not sat down since morning. We got something from the second one, Farron said. They stood in the family waiting area again. Same chairs, worse coffee, the window now showing a parking garage lit by sodium lamps in the early dark. He's more willing to talk than the first, Sloane said. She had a precise, efficient way of speaking that Nora had always found useful in high-pressure contexts. The first one is trained to resist. This one was hired at a remove. 2 cutouts between him and the principal. He knows a name. Nora waited. Rear Admiral Dennis Volk, Farron said. The name sat in the room. Pacific Command Logistics, Nora said. Currently, Farron said, prior to that, he ran a Joint Special Operations Coordination Office out of Stuttgart. The operations that Alcott was documenting, 3 KIA operators on suspect missions, all 3 of those missions were routed through Stuttgart during Volk's tenure. He's covering his own operations, Nora said. That's the shape of it, Sloane said. We think the original black site network was his. He built it over 7 years, diverted assets, used the deaths of operators in the field to close loose ends. Alcott stumbled onto the financial trail 6 months ago, started pulling threads. And Volk found out, Nora said. We believe he found out approximately 3 weeks ago, Farron said, which is when Alcott's security situation suddenly became more complicated. Where is Volk now? Farron and Sloane exchanged a look that lasted about 1 second too long. He's in Augusta, Farron said. He arrived this afternoon. He's currently at the Federal Building, 4 miles from here, ostensibly to provide oversight support for the investigation into the attempts on Alcott. He paused. He requested to be briefed on Alcott's condition and security status. Nora looked at him. And you briefed him? Partially, Farron said, before we had the second contractor's information. So he knows your current security setup. Not the full revised configuration. But enough. Farron's jaw moved. Enough. She thought about that, about what it meant to have the principal threat sitting in the Federal Building 4 miles away with partial information about where his failed contractors were and what they might have said, running the clock on his options. He's going to move, she said. Not another contractor. He's burned too. They're both talking. He'll want to close this himself or through someone he trusts completely. That's our assessment, Sloane said. What do you want from me? Farron looked at her. He had the expression of someone about to say something that cost him something. We want to use Alcott as bait, he said. Controlled situation, managed exposure. Draw Volk in before he has time to plan a third approach. The room was quiet. Alcott is 36 hours post-surgery, Nora said. He has a chest drain, a repaired vessel, and a soft tissue bruise from moving himself out of the line of fire 2 hours ago. We know. He can't be moved without clinical risk. We know that too. And you want to put him in a situation where someone is deliberately targeting? We want to end this, Farron said, not harsh. Tired. Volk has been doing this for 7 years. There are operators listed KYA who are not dead. They are in locations that only Volk knows. If we don't close this now before he has time to disappear. The operators, she said. How many? Sloane opened a folder. Confirmed missing, not confirmed dead. 4. Possibly more. She sat back. 4 people in locations only one man knew. 4 people who were alive because they hadn't been useful enough to kill yet, or dead because the timing hadn't been right, and there was no way to know which without getting to Volk before he destroyed whatever record existed. What does Alcott say? She said. He hasn't been fully briefed yet, Farron said. We wanted to talk to you first. Why? Because he'll agree to whatever we propose if you agree to it, Farron said simply. And we need to know if it's medically viable before we ask him. She looked at him for a long moment. If we do this, she said, I have final authority over his medical status. If I say pull him out, we pull him out. No argument. Agreed. And you tell me everything, not the edited version. Everything you have on Volk's likely approach and timeline. Agreed. Give me an hour with Alcott first, she said. Then we talk about what viable looks like. Cham. She told Alcott at 8 p.m. She sat in the chair that lived in the corner, the family chair, the vigil chair, and she told him in plain language what Farron had said and what the situation was and what the options were. He listened without interrupting. He had the practiced stillness of someone who had received a lot of significant information in uncomfortable settings and had learned that stillness was more useful than reaction. When she finished, he was quiet for a moment. The 4 operators, he said. Yes. I have names, he said. In the documentation. If we can't verify their status before Volk, I know, she said. Then we do it, he said. Whatever Farron is proposing. You haven't heard the proposal. Voss? He looked at her with the flat, certain look of a man who has already run the calculation. I know what it is. It's the obvious move. They use me as the point of contact, create the impression that I'm more isolated than I am, and wait for him to come to me. In a hospital room where you're attached to... I've done operations in worse condition, he said. You weren't my patient then. I wasn't anyone's patient then, he said. That was the problem. She didn't smile, but it was close. There's something you should know, she said, before we get into the operational piece. He waited. Volk has your documentation location, or he has enough to guess at it. She watched his face. The second contractor had a data extraction device on him, the one that discharged against the wall. It wasn't just to disrupt your pacemaker leads. It was also capable of short-range encrypted data pull from networked medical devices. Alcott went still. If your documentation was on any networked system in this room, it wasn't, he said. And then with the first real flicker of uncertainty she'd seen in him, it wasn't on a networked system in this room. You sound less certain than you did a second ago, she said. He closed his eyes briefly. There's a secondary file. A backup I built 2 weeks ago because I didn't trust the primary chain anymore. It's on a hospital system. This hospital system, the admission intake database, He stopped, reorganized. My aide, before I was injured, he thought he was doing me a favor. She stared at him. I didn't know he'd used Harmon Valley specifically until I was already here, he said. I thought it was a different facility. There was a transfer in the intake chain. So the backup documentation, she said carefully, is currently in the administrative database of the hospital that Volk now knows is where you're located. Yes, he said. And if the data extraction device pulled anything in this room, it would have hit the network metadata, he said. Not the files themselves, but it would show him there's something here. She stood up. I need to tell Farron, she said. I know. She was at the door when he said her name. She stopped, turned. I'm sorry, he said, for bringing this here. Don't apologize yet, she said. We haven't fixed it. She went back out into the corridor and stood for a moment with her hand still on the door and thought about what it meant, that somewhere in Harmon Valley Medical Center's administrative network, there was a file that documented 7 years of illegal operations, 4 missing operators, and the name of a rear admiral who was currently 4 miles away calculating his next move. And that Volk, if that extraction device had done what it was capable of, might already know it. Her phone buzzed. Mercer. She picked up. We have a problem, he said. What kind? Volk just left the federal building, he said. He took a vehicle alone, no security detail, and he turned off his phone. She was already moving toward the nursing station. How long ago? 11 minutes, Mercer said. We lost the vehicle on Broad Street. 11 minutes, 4 miles. The math was not comfortable. Get everyone to their positions, she said, and get Farron to the server room, now. Why the server room? Because that's where this ends, she said, if we don't move faster than he does. She pulled the stairwell door open and went through it at a run, because somewhere in the building below her, the evidence that could bring down everything Volk had built was sitting unprotected in an administrative database, and a man with 7 years of practice at making problems disappear was 11 minutes away and closing. The server room was in the basement. She knew this from her orientation tour, a detail she'd cataloged automatically along with everything else. Stairwell locations and loading dock access, and which corridors dead-ended and which ones looped, because she had spent 11 years in the habit of mapping every building she entered, and 2 years of civilian life had not fully untrained it. Basement level, east corridor, behind the facilities management office. Access required a key card that she didn't have. She was already calling Mercer before she hit the first landing. Server room, basement east, she said when he picked up. I need access, and I need someone from IT who knows the network architecture. Right now. IT is overnight skeleton crew. Then get me whoever is there. And Mercer... She pushed through the ground floor door and turned east toward the facilities corridor. If Volk is coming for the documentation, he's not going to come through the front door with a weapon. He's going to come in as himself, a flag officer with federal credentials asking to review records relevant to an active investigation. A pause. He'd have the authority. He'd have the appearance of authority, she said, which is the same thing until someone stops him. Get Farron to call the hospital administrator, whoever approves after-hours records access, and have them told that no access is granted tonight without direct confirmation from Farron himself. Not email, not a phone call from someone claiming to be Farron. Farron's voice. In person or on a verified line. That's going to take 10 minutes, she said. You have maybe 8. Move. She reached the facilities office. The overnight maintenance supervisor, a man named Greer, who was somewhere in his 50s and had the unhurried manner of someone who had seen everything a hospital building could produce at 9 p.m. and had stopped being surprised by any of it, was sitting at his desk with a cup of coffee and looked up when she came through the door with the particular expression people get when they've just been interrupted in the middle of something quiet. Server room, she said. I need in. Federal situation, 3rd floor. I can get you Deputy Director Farron on the phone in 30 seconds to confirm. Greer looked at her badge, the temporary one, the one Hale had left at the nursing station that said Nora Voss, RN, and not anything else, and then looked at her face and made some private calculation that apparently came out in her favor, because he stood up and pulled a key card from the drawer without asking her to wait. I'll need to log the access, he said. Log everything, she said. I want a record. The server room was cold, the kind of deliberate, maintained cold that server infrastructure requires, pushed out by a dedicated HVAC unit that hummed at a frequency you felt in your back teeth. The racks were tall and uniformly gray, and the indicator lights ran in patterns that were meaningless to her. What she needed was someone who understood the network architecture well enough to find a file that had been embedded in the administrative intake database by a naval officer's aide who had thought he was helping. The overnight IT contact was a young man named Priya Ose. Not a man, Nora corrected herself, walking in. Mid-20s, sharp eyes behind rectangular glasses, a thermal cup of something at her elbow, and the look of someone who had been pulled from a monitoring routine and was not sure whether to be annoyed or interested. You're looking for a file in the intake system, Ose said, before Nora had fully stated the situation. Nora stopped. How did you know? Because someone accessed it remotely 40 minutes ago, Ose said. From a device I didn't recognize. I flagged it internally and was trying to figure out who to call. She turned back to her screen. I didn't pull the file. I don't know what's in it, but I can tell you it was accessed, not extracted. Whoever pinged it found the location but didn't complete the transfer. The data extraction device. The contractor in Alcott's room. It had found the file, confirmed its location, but the discharge, the moment Nora had deflected his arm, had interrupted the pull before it completed. Volk knew the file existed. He knew it was here. He didn't have it yet. Can you move it? Nora said. Move it where? Somewhere encrypted, somewhere offline. Ose's expression shifted into the particular look of someone who has been asked to do something that is technically possible but operationally irregular. I'd need authorization from Deputy Director Farron, Naval Intelligence, Nora said. He's in this building. I can have him here in 4 minutes. Then get him here, Ose said, because I'm not moving federal flag data on someone's word. No offense. None taken, Nora said. Lock the access in the meantime. Already done. She called Farron. He was already in motion. She could hear it in the background of the call, the specific ambient noise of a corridor, multiple footsteps. She told him the situation in 90 seconds. File located, access logged, not extracted, IT on site, authorization needed. On my way, he said. 3 minutes. She stayed in the server room and watched Osei work and thought about what Volk was doing right now, where he was in the 11 minutes that had become 14 minutes and then 18, and the image that kept assembling in her mind was not a man with a weapon approaching a hospital. It was a man in a car somewhere, on a phone, running the contingency. Because a man who had sustained 7 years of covert illegal operations without detection was not a man who had only one approach, and the direct access play might have already been abandoned in favor of something she hadn't anticipated yet. Farron arrived. He spent 45 seconds with Osei, and then the file was moving, copied to an encrypted offline drive that Farron had brought from upstairs, the kind of hardware that gets carried by intelligence officers who anticipate needing it, which told her he had anticipated needing it, which told her he was further ahead in his thinking than he'd let on. "Is the original intact on the system?" she asked. "Yes," Osei said. "Leave it," Nora said. Farron looked at her. "Leave it there," she said. "Visible, accessible to someone with the right credentials. If Volk gets into the system, I want him to find it," she said. "I want him to try to pull it, because the moment he touches that file with his credentials, you have him. Not the contractors. Him, personally, on a federal system, with a documented chain that goes directly from this hospital's network to a device registered to his access profile." Farron was quiet for a moment. "You're using the file as a trap." "I'm using it as what it already is," she said. "Evidence. I'm just making sure it's evidence with a timestamp and an access log attached." Osei looked between them, made no comment, turned back to her screen. "He'd know it could be a trap," Farron said. "Yes," Nora said, "but he also knows that if he doesn't get to that file, we close the case with what we have and he goes down for the contractors alone, which is 15 years minimum, but probably not enough to recover the operators or expose the full network." She paused. "He needs to destroy it. That's not a choice anymore. It's a requirement, and he knows it." Farron looked at her for a moment with the expression he'd been giving her intermittently for the last several hours, the one she couldn't entirely read, somewhere between assessment and something older than assessment. "All right," he said, "we set the trap." He turned to Osei. "I need a log alert the moment anyone touches that file. Direct to my phone." "Set," Osei said, without looking up. She went back upstairs at 9:15. The third floor was quiet in the way that hospitals are quiet late at night. Not silent, but reduced. The daytime frequency of movement and noise compressed to its essential minimum. The agents were in their positions. Sandra had gone off shift and handed over to a night nurse named Reyes, who had been briefed, in limited terms, on the security situation and had the focused, slightly heightened alertness of someone who is being careful without fully knowing why. Alcott was awake when she came in. He was doing the thing she'd seen him do several times now, lying still with his eyes open, running something through his head, burning through whatever mental energy the medication hadn't claimed. He looked at her when she came in, and the question on his face was clear enough that she answered it without him asking. "The file is secure. We have a copy off-site. The original is still in the system as bait." He processed that. "Volk will know it might be bait." "I know. He'll try anyway. That's what we're counting on." He was quiet for a moment. Outside the window, Augusta was dark and wet. It had started raining sometime in the last hour, a thin, persistent rain that made the parking lot lights blur. "The 4 operators," he said. "Farron's team is working on locations based on what you've documented. There are coordinates in the file, encrypted within the main archive, nested, not obvious. Tell Farron to look for a weather notation in the appendix. It's not weather." "I'll tell him." "Nora." He used her name the way he had earlier, with a specific weight to it, like he was making sure she heard what came next. "If Volk gets into this building tonight, he won't get to you." "I wasn't going to say that," he said. "I was going to say, if he gets into this building, I want you to let the agents handle him. You've been running on, 4 hours of sleep in 36 hours? And your shoulder, My shoulder is fine. It's not fine. It's been not fine since this morning. And you haven't said anything because saying something would mean someone tries to take you off the floor. He looked at her steadily. I'm right. She looked back at him. Yes, she said. You're right. So if it comes to it, I'll be smart about it, she said. That's the best I can offer. He seemed to consider whether that was enough, decided, apparently, that it was going to have to be. There's something else in the file, he said. Something I didn't tell Farron yet because I needed to think about how to say it. She sat down in the chair. It was past 9 p.m. and her body was starting to have opinions about that, and she let herself have the chair. The Black Site Network, he said. The one Volk built. 3 of the 4 missing operators, I have strong reason to believe they were held at a facility that was nominally under Joint Command oversight, which means someone above Volk signed off, not on the detention, on the budget line that funded the facility. She felt the weight of that settle. How far up? I don't know yet, he said. That's what I couldn't finish documenting before. He gestured at himself. Before someone tried to kill me. It might stop at Volk. It might not. If it doesn't stop at Volk, she said, then arresting Volk tonight doesn't end this. No, he said, it doesn't. He held her gaze. But it's where we start. Farron's phone went off at 11:43 p.m. She heard about it through Mercer, who came to the door of Alcott's room with his radio in one hand and the specific expression of controlled urgency that meant something had moved. Someone accessed the file, Mercer said, 6 minutes ago. She was on her feet before he finished the sentence. Credentials? That's the thing. He paused. It wasn't Volk's credentials. It was a hospital administrator's login, someone named Paulson, deputy director of finance. She stood very still. Is Paulson here? She said. His car is in the lot, Mercer said. According to the overnight desk, he came in at 11:15 saying he had a billing issue that required after-hours access. They logged him in. Volk recruited him, she said, or coerced him. He's using a local access point to avoid the credential flag. She was already moving toward the door. Where's Paulson now? 3rd floor administrative annex, Mercer said. 1 floor above us. Where's Volk? We don't know. Then Volk is in this building, she said. He sent Paulson in first to pull the file, and he's coming in behind. Find him. Every entrance, every elevator, every stairwell. She was in the corridor now. And get someone to Paulson before he completes the transfer. She took the stairs. 4th floor. The administrative annex was a cluster of offices that were dark and locked at this hour, except for one, at the end of the corridor, where the light under the door was visible from 30 feet away. She went to it, tried the handle. Unlocked. Paulson was inside. A man in his 50s, heavy-set, with the look of someone who had been awake too long and was frightened in the restrained, rigid way of people who are frightened by something they brought on themselves. He was at the computer. The transfer progress bar on the screen said 62%. He saw her in the doorway and his hands came up from the keyboard immediately, which told her he wasn't a trained operative and hadn't been prepared for physical confrontation. He'd been prepared for a data task, clean and removed from consequence, the kind of thing that feels manageable when someone who frightens you tells you that it's manageable. Step away from the computer, she said. He stepped away from the computer. She crossed the room and pulled the network cable from the back of the tower. The transfer bar froze at 62%, which meant 38% of the file was still on the hospital system, which meant the trap had not been fully sprung. Volk didn't have the complete documentation, couldn't be certain what he had and what he didn't. She looked at Paulson. Who contacted you? I don't... He stopped, started again. His hands were shaking in a way that was not at all like her shaking hands, not physiological, not managed, just fear expressing itself honestly. A man called me 3 days ago. He said he knew about... Another stop. He knew something about me, and he said if I did this one thing, he'd... What's his name? He said his name was Volk. Did you meet him in person? Tonight, Paulson said, in the parking garage. He gave me my login. It shouldn't have worked. My access doesn't normally cover clinical records, but he'd done something to elevate... He swallowed. He's still there. He said he'd wait for me to confirm the transfer. She looked at him for one long second. "Sit down," she said. "Don't touch anything. Don't call anyone. There are federal agents coming up the stairs right now, and you're going to talk to them." She was already on the phone to Mercer. "Parking garage. He's in the parking garage. Get everyone there now." The garage was connected to the hospital by an enclosed walkway on the second level. She came through it at 11:58 p.m. with 2 agents 20 feet behind her, and Mercer on the radio coordinating with the 3 units that were converging from the street entrances. The garage was 4 levels, 600 spaces, and mostly empty at midnight. Her footsteps echoed off concrete. She went to the second level because that was where the walkway connected, because a man waiting for confirmation of a data transfer would want to be close to his exit and close to his point of contact, and because second levels of parking garages have a sightline advantage over ground level that a trained officer would instinctively use. She found him at Bay 2C. He was standing beside a dark gray sedan, phone in hand, looking at the screen with the focused attention of someone waiting for a message that was overdue. He was in civilian clothes, dark jacket, no insignia, and he was not what she'd expected, which was a category error on her part, because she had been building an image from information, and information is not a person. Rear Admiral Dennis Volk was 61 years old, and he looked like someone's grandfather. That was the honest description. Silver-haired, medium build, with a face that had settled into the lines of someone who had spent decades being trusted and found the posture comfortable. He looked like the kind of officer who gave good speeches at retirement ceremonies and remembered the names of junior enlisted. He looked up when she came around the concrete pillar, and the grandfather face went away. What replaced it was not menace exactly. It was something more controlled than menace. The absence of panic in a situation that should produce panic. The stillness of someone running a very fast calculation and not liking the result but not being undone by it. "You're the nurse," he said. "Yes," she said. "The transfer didn't complete," he said. It wasn't a question. "No." He looked at her for a moment. Then he looked past her, at the 2 agents coming around the pillar, at the sound of footsteps from the ramp below, at the geometry of the situation. "I want to talk to Farron," he said. "That's going to happen," she said. "Right now I'm going to need you to put the phone down and put your hands where I can see them. I have federal rank. You're in a parking garage at midnight after sending a coerced civilian employee to steal evidence from a hospital network," she said. "Your rank is not the operative variable right now." Something moved across his face. Not anger, not fear. Something that was almost in a removed and complicated way, like respect. The way someone looks when they've been correctly described. He put the phone on the hood of the car. He put his hands up. The agents came forward. She stepped back. Mercer said something into his radio that she didn't fully hear because she was looking at Volk's face and thinking about the 4 operators whose coordinates were nested in a weather notation in an appendix of a file that was currently frozen at 62% on a hospital computer 1 floor above them, and thinking about the budget line that funded the facility that held them, and thinking about who had signed off on that budget line, and what it was going to take to pull that thread. One of the agents had Volk by the arm and was saying the words, federal custody, rights, the procedural language that turns a person into a case. And Volk was listening with the composed, evaluating expression of someone who is already thinking about what comes next, not what is happening now. She watched him. "The operators," she said, quiet enough that only he heard. "The ones you listed as KIA." His eyes moved to her. "You're going to tell us where they are," she said. "Not because someone will make you, because every hour you don't, something can go wrong at whatever facility you're using. And if something goes wrong and we can't prove you cooperated," she let that sit. "You understand the difference between the sentence you're looking at now and the sentence you'd be looking at if 4 operators die in custody while you're calculating your options." He looked at her for a long moment. "I want an agreement in writing before I say anything," he said. "That's between you and Farron," she said. "But the conversation needs to start tonight, not tomorrow." He held her gaze for another second. Then he nodded. Once, minimally. The agents moved him toward the ramp, and she watched them go and felt something shift in the specific architecture of tension she'd been carrying for, she calculated, approximately 27 hours. not release. That wasn't the right word. More like the moment a structural load redistributes. The weight doesn't disappear, it just settles differently. Her phone buzzed. Farron. She picked up. "We have him," she said. "I know," Farron said. Mercer called. A pause. "There's something you need to know before you come back inside." She waited. "We ran the budget authorization," he said. "The one for the facility, the co-signer on the original documentation." "Who?" she said. Another pause. Farron, who had spent 40 years in intelligence and had the voice of someone who had delivered difficult information in difficult moments more times than he could count, took a breath that she could hear clearly through the phone. "It's someone who has been in this building tonight," he said. "Someone we've had access to since this afternoon. Someone who has been sitting in federal oversight capacity, officially with credentials, watching everything we did." She stood in the empty parking garage with the rain audible on the roof above her and the sound of Volk being processed fading down the ramp, and she felt the full weight of what Farron was telling her arrive in the way that significant information arrives when you've been awake for 30 hours, completely, without mercy, all at once. "Tell me the name," she said. Farron said the name. She stood in the parking garage and the rain came in sideways through the open walls, and the name sat in the air between her ear and the phone like something with physical weight, and she did not move for 3 full seconds, which was long for her. Vice Admiral Conrad Hess. She knew the name, not personally, not the way she knew Alcott, not the way you know someone from shared operational space or mutual crisis. She knew it the way you know the names of people who exist 2 levels above your operational ceiling, names that appear on approval chains and oversight documents, and the headers of after-action reports that get filed in systems you have to request access to read. Hess ran the Joint Oversight Committee for Special Operations Coordination in the Eastern Command structure. He was 63 years old, and he had a reputation for being methodical and exacting and for running assessments that made people reorganize their careers. And he had been sitting in this building since 4 in the afternoon attending Farron's briefings and reviewing security configurations and asking questions that Farron had answered because Hess had the credentials and the rank and the entirely plausible reason to be there. While Volk moved in the parking garage 4 miles away, Hess had been on the 2nd floor of Harmon Valley Medical Center, drinking the hospital's catered coffee and learning in precise detail exactly what Farron's team knew and didn't know. "Where's he now?" she said. "2nd floor conference room," Farron said. "I have 2 people outside the door. He doesn't know we have Volk." "He will soon," she said. "Volk's missed a check-in by now." "I know." "Don't move on him yet," she said. "I'm coming back in." She was already walking toward the enclosed walkway, phone still at her ear, the rain loud on the concrete above her, and then quiet as she moved inside. The corridor was fluorescent and warm and smelled like every hospital corridor she'd ever been in, and she walked it fast and thought about what she was walking into. A vice admiral with 40 years of institutional relationships and a lawyer's understanding of how to occupy authority in a room. A man who had spent the last several hours being briefed on her capabilities, her background, her access, her role in the last 32 hours, while appearing to provide oversight. He had been assessing her threat profile from across a conference table, and she hadn't known she was being assessed, which was the kind of operational error she didn't usually make, and the fact that she hadn't known told her something about how good he was. "What do you want me to do?" Farron said. "Get me in that room," she said. "Just me and you, before he lawyers up." "You think he'll talk?" "I think he's been controlling this narrative for 7 years, and he's not going to stop instinctively just because the situation changed," she said. "He's going to try to frame it. Whatever comes out of his mouth in the next 10 minutes is going to be an attempt to frame it." She pushed through the door to the stairwell. "I want to hear what frame he chooses," yammed. The 2nd floor conference room had the slightly stale quality of a space that had been occupied for too long by people doing difficult work. There were coffee cups and a yellow legal pad, and the particular arrangement of chairs that happens when a formal meeting has been in session for hours, and people have stopped caring about the original configuration. Hess was at the far end of the table when she came in with Farron. He looked up. He looked at her first. Not at Farron, at her, specifically, with the quick evaluating scan of someone who has been waiting for a particular variable to arrive and is now calibrating against its actual appearance. She let him look. She walked to a chair 2 seats down from him and sat down, not at the far end, not across the room, close, within normal conversation distance, because proximity was its own kind of information, and she wanted to watch his face without the length of a conference table in the way. Farron sat to her left. He put a folder on the table and left it closed. No one spoke for a moment. Hess broke the silence, which told her something. A man with nothing to fear lets silence accumulate. A man running calculations fills it. "Commander Voss," he said. He used the rank. Deliberate choice. Not an oversight, not a courtesy, a move. He was acknowledging what he knew about her, establishing that he had information, positioning himself as someone with context rather than someone caught. "Vice Admiral," she said, "I understand there's been a development." Farron said, "What makes you say that?" "Mercer's radio traffic," Hess said. "The encryption was correct, but the volume wasn't consistent with routine patrol. I've spent 40 years reading operational signals." He placed his pen on the legal pad with the deliberate care of a man who has decided he is done taking notes. "You have Volk." Farron was quiet. "Which means," Hess continued, with the measured cadence of someone choosing each word the way you choose footing on unstable ground, "that whatever he's communicated is now the basis of a vector that moves above his rank." "That would depend on what he said," Farron said. "Of course." Hess looked at his hands for a moment, then at Nora. "I'd like your read on this, Commander. You've been closest to the patient. You have operational context that the deputy director doesn't have from sitting in briefings." He paused. "I'd be interested in your assessment of how much of what Volk might say is verifiable versus—" "You should stop talking," she said. He stopped. "And ask for a lawyer," she said. The room was completely quiet. Outside, through the wall, she could hear the faint ambient hum of the hospital, distant footsteps, an elevator opening, the building's infrastructure doing its indifferent work. "Whatever you're constructing right now," she said, "whatever frame you're building for this conversation, you've been building it since 4 this afternoon and you're very good at it, and it doesn't matter. Because the file exists. The file that Volk was trying to pull from this system tonight exists and is now on an encrypted drive in Deputy Director Farron's possession, and it contains 7 years of documentation that Alcott built from financial records and operational logs and casualty reports that don't match their own supporting evidence." She held his gaze. "The budget authorization for the facility that held 4 active duty operators, the co-signer, that's in the file." Something moved across his face. Not guilt, not fear. Something more controlled than either of those things. The expression of a man who has just confirmed a calculation he'd already run and found the result to be what he expected, and was now moving to the next calculation. That was the thing about Hess that was genuinely frightening. He was never surprised. He'd built a system that didn't rely on things going well. It relied on always knowing what came next. "I'd like to contact my attorney," he said. "That's your right," Farron said. She stood up. She was done. She'd heard what she came to hear, which was the frame he'd chosen, which was no frame at all. A clean pivot to counsel, no attempt to explain, no attempt to bargain, no attempt to construct an alternative story. Which meant he'd already concluded that the story he'd built for 7 years was finished, and he was moving immediately to the next phase, legal mitigation. 7 years. And he pivoted out of it in under 4 minutes. She went to the door. Behind her, she heard Farron begin the language of federal custody, which was procedural and thorough and would take several minutes, and she went out into the corridor and stood against the wall for a moment and let the tension that had been running through her since she heard his name move through her body and out, the way you let a current pass rather than fighting it. The agents who had been in the corridor came in past her. Hess would be formally arrested, read his rights, transported. His attorney would be contacted. The process that ground slowly and thoroughly and without mercy when the evidence was sufficient was now, finally, grinding. She went upstairs to her patient. At 2 a.m., Farron found her in the SICU corridor with the news she'd been waiting for. He walked toward her without urgency, without the forward lean of someone carrying a new emergency, and that body language told her before he said anything that what he was bringing was different from everything he'd brought in the last 32 hours. "The file," he said. "Alcott's weather notation. Our analysts located it 40 minutes ago." She waited. "2 sites," he said. 4 operators." He paused. "All 4 alive. Extraction is already in motion." She looked at the door to Alcott's room. "He needs to know." "That's why I came to find you first," Farron said. "I thought, together." She pushed the door open, and they went in. Alcott was not asleep. She'd stopped expecting him to be asleep. He had the particular wakefulness of someone whose nervous system had been in threat response mode for so long that it didn't fully release even when the immediate threat was resolved. He turned his head when they entered, and he looked at Farron's face, and whatever he read there made something in his own face go very still. "Tell me," he said. "All 4 are alive," Farron said. "Extraction is in progress. Estimated completion in 72 hours depending on location logistics." Alcott closed his eyes. She stood at the foot of the bed and did not say anything. This was not a moment that needed anything added to it. 4 people who had been listed as KIA, who had been held in locations that only one man knew, who had been waiting in a silence that had no official name. 4 people were going to come home because a man in this bed had spent 6 months pulling financial threads that didn't add up, and had kept pulling even when someone decided the pulling needed to stop. When Alcott opened his eyes, they were wet at the corners, and he left them that way, which was the correct choice. Which was the choice of a man who had been through enough that managing his appearance in this particular moment was not a priority he had energy for. "All 4, he said. Not a question, just saying it. "All 4, Farron confirmed. A long moment. "The coordinates were nested in the appendix," Alcott said, to Nora specifically. "The weather notation." "I told Farron," she said. "It worked." He nodded, looked at the ceiling, breathed. She stayed until he was settled, and then she went back out into the corridor and stood with her back against the wall and thought about what it meant. Not abstractly, not institutionally, but specifically, 4 people in 2 locations who were going to get on a transport and leave those locations, who had been waiting without knowing if anyone was looking, who were going to find out that someone had looked. That Alcott had looked. That a file frozen at 62% in a hospital database had been enough. It was not a clean story. It was never going to be a clean story. But the 4 operators were coming home, and Hess was in federal custody, and Volk was cooperating, and the file was on an encrypted drive in Farron's possession. And those were facts, and facts had a weight that did not require her to feel any particular way about them in order to be true. She let herself feel what she actually felt, which was tired and relieved and sad, in a complicated way she couldn't entirely locate. And then she went to finish her documentation because Alcott's drain output had shifted in the last hour, and it needed to be noted and communicated to the surgical team before the morning consult. And that was also a fact, and it also mattered, and nobody else was going to catch it if she didn't. The sun rose over Augusta at 6:47 a.m., and she was still in the hospital. She had not slept. She had charted, monitored, communicated, and at 4 a.m. had called the surgical resident on backup because Alcott's drain output warranted a look, and the resident, a young man named Park, who arrived in 7 minutes looking like he'd dressed in the dark, which he probably had confirmed her read and adjusted the management protocol, and that had been the right call. And it mattered because a repaired vessel near a human heart requires attention that doesn't take breaks just because the espionage situation has been resolved. At 7:15, Marcus Hale appeared on the 3rd floor. He was in his white coat, and he had the look of a man who had slept badly and briefly and had spent the driving time processing something that didn't resolve neatly. He came down the SICU corridor and stopped when he saw her at the nursing station, and for a moment he just stood there with his hands not quite finding a position. He came to the counter. He placed both hands on it, open, and looked at her. "The federal team gave me a summary this morning," he said. "I asked for it. They told me enough." She looked at him and waited. 22 years, he said. "I've been doing this for 22 years. I've worked with residents, attendings, nurses, medics, people who came to this work from every direction you can come from." He stopped. This was not a speech he had written. She could see him finding it in real time, which was the most honest version of it. I formed a view of you on day 2, based on things that I'm not going to reconstruct the reasoning because the reasoning was wrong at the foundation and walking you through it doesn't serve anything. No, she agreed, it doesn't. What I want to say, he said, is that you would have been exactly what you were in that room, with that patient, in that corridor, in every situation that happened in the last 3 days, regardless of what was in your background. The background explains some things. It doesn't explain your judgment. That's yours. She looked at him steadily. I know, she said. He absorbed that. Something in his face did a small, visible thing, not embarrassment exactly, more like the specific adjustment of a person who has said something they meant to be generous and has been received by someone who didn't need the generosity but accepted it gracefully. The suspension is formally rescinded, he said. HR is correcting the record today. Thank you, she said. He started to say something else, then decided against it and nodded instead and left. And she turned back to the chart she'd been reviewing, and her hands on the counter were completely still. That's it. Farron came at 9 a.m. with 2 members of his team and a woman in a dark blazer who introduced herself as Marsh, Deputy General Counsel for Naval Operations, and who had the quality of someone who carries institutional authority not as performance, but as a settled fact about herself. They used the family waiting room. Someone had found better coffee. Small mercy. Marsh opened her folder. She had the delivery of someone who has read this kind of language many times and understands that its precision is the point, not a bureaucratic obstacle to the point. Commander Nora Voss, she said, Naval Special Operations Medical Command, classified direct action support assignments spanning 11 years, officially designated killed in action, classified Operation Halcyon Cross, 22 months prior. The KIA designation was administrative, procedural protection for ongoing mission structure. As of 0600 this morning, that designation is formally reversed. Your service record is restored. Your rank is reinstated effective immediately. She said nothing. Additionally, Marsh said, your actions at this facility over the last 32 hours are being submitted for formal commendation. The recommendation originates with Admiral Alcott. That's not necessary, Nora said. The Admiral disagrees, Marsh said, without inflection. And he has the rank. Farron leaned forward slightly. There's an offer, he said. Not an order. An offer. She waited. Joint Medical Tactical Command, he said. It's been a proposal for 3 years without someone to build it. The concept is a training program integrating field trauma, combat medicine, and triage under active threat. The gap between standard military medicine and what direct action environments actually require. Full command authority, curriculum, staffing, training protocols. Where? Fort Caldwell, Virginia. She looked at the window. The parking garage was ordinary in the morning light, concrete and sodium lamps gone pale in the daylight. She thought about what this offer meant and what declining it would mean. And then she thought about something more specific, the field hospital in the place she wasn't supposed to discuss, and the particular silence that followed it, and the 22 months of progressively smaller cities, and the 9 days at Harmon Valley where she had restocked crash carts and been mocked for shaking hands, and had understood, without needing to examine it too closely, that she was trying to find the smallest version of herself that could fit inside an ordinary life. The ordinary life had lasted 9 days. I'll take it, she said, with conditions. Name them, Marsh said. Civilian integration, she said. The curriculum isn't only for military personnel. The skills that apply in a combat medical environment apply in every trauma bay in this country, and they don't get there because no one has built the bridge. I want to build it. Marsh wrote something. And I want to roll in the post-extraction assessment for the 4 operators being recovered, she said. Medical evaluation that understands operational detention context. I want to be part of that team. Within your command authority under the new posting, Farron said. Already. Then I have no other conditions, she said. Marsh closed the folder. Formal paperwork within 48 hours. Take 72, she said. I have a patient to finish monitoring. Alcott's surgical drain was cleared for removal on day 3 post-op. She wasn't assigned to his room for the procedure. She'd gone home the night before, finally, had slept 9 hours without dreaming, and come back for one final shift before her transition out of Harmon Valley's nursing roster was complete. She was in the corridor doing end-of-shift charting when the surgical team finished with him, and she looked through the window. He was sitting up. Not fully 45 degrees, which was the right angle for where he was in his recovery, which was the angle of a man who was going to get better. He was talking to the surgical resident, and she couldn't hear what he was saying, but his hands were moving when he talked, which had not been true 48 hours ago. That was a good sign. The body returns to its habits when it begins to feel safe again. He saw her through the window. She raised one hand. He raised one back. She finished her charting, signed off on her last chart at Harmon Valley Medical Center, handed her temporary badge to Deborah Malloy at the nursing station, and walked out. The federal indictments were filed 11 days later. She read about them in a parking lot in Augusta, on her phone, the afternoon before her flight to Virginia. The report used careful language, alleged, charged with according to investigators, and described the charges in the flat, precise terms of legal documents, which did not fully capture the texture of 7 years of institutional corruption, but was the correct register for the information. Vice Admiral Conrad Hess, 9 charges: conspiracy to commit murder, obstruction of justice, unauthorized detention of military personnel, misappropriation of classified operational funds, abuse of command authority. The report noted that he had entered a not guilty plea through counsel and declined to comment publicly. It noted that his attorney had characterized the charges as politically motivated, which was what attorneys were paid to characterize things as, and which the documented evidence would eventually address. Rear Admiral Dennis Volk, 7 charges, with a cooperation agreement that had accelerated the recovery of the 4 operators and would factor into sentencing. She had complicated feelings about the cooperation agreement. She did not work to simplify those feelings. Complicated situations produced complicated outcomes, and she had learned a long time ago that the desire for clean moral resolution was understandable and mostly useless. The 2 contractors, federal charges pending trial. The first one's attempt to implicate her had been formally dismantled by the talk screen in the access logs and Mercer's statement, and Sandra Obi's statement, and a timeline that physically could not accommodate his account. The file on that was closed. Paulson, the finance director, cooperating fully, terms under negotiation. She had no particular feeling about Paulson. She understood him, which was different from having a feeling about him. A frightened man makes choices under pressure from someone more powerful than him. That was not an excuse, it was a description, and descriptions were more useful than judgments when you were trying to understand how systems of coercion actually operated. She put her phone in her pocket and sat for a while in the parking lot and thought about the 4 operators who were in transit from 2 separate locations. She had gotten a message from Farron the previous morning, a single line, no elaboration needed, all 4 out, all 4 stable. She had read it twice, sitting in roughly the same parking lot, and had looked at the sky for a moment and had not needed to say anything about it to anyone. Some things didn't need to be said. They just needed to be true. Fort Caldwell in October was fog and ridgelines and the smell of wood smoke from somewhere past the training fields. She arrived with 2 bags and a box of books and spent the first 3 days doing what she always did, learning the building, mapping the exits, cataloging the people she passed in the way that 11 years had made automatic. Not because she expected threats here, because it was the habit she lived inside, and there was no point fighting it, and the habit had kept her and people near her alive often enough that she'd made a certain peace with it. The program had a name, Joint Medical Tactical Command, JMTC, and a budget and an empty curriculum. She spent 2 weeks building the structure. The staff she assembled were not the obvious choices, and she didn't care. She chose a Navy medic named Rourke, who had 3 combat deployments and a managed anxiety disorder, and the fastest accurate clinical assessment time she'd tested in 20 interviews. She chose a civilian trauma surgeon named Dr. Adaize Okonkwo, who had never served a day in the military and had developed a mass casualty triage protocol at her Memphis Level 1 center that was the most efficient thing Nora had ever reviewed in print. She chose a former Marine combat instructor named Stafford, who had retrained as a nurse and who looked like an unusual combination and turned out to be the best person she'd ever worked beside in a simulated crisis environment. None of them were easy. Rourke second-guessed himself in the first week until she told him directly to stop. Not because the self-questioning was wrong, but because it was happening at the wrong point in the decision cycle and was costing him time he didn't have. He heard her, which was the important thing. Okonkwo didn't like the military structure of the program and said so in the first meeting, clearly and without apology, and Nora didn't like some of Okonkwo's assumptions about military medicine and said so back. And after 45 minutes of that, they had a working relationship based on knowing exactly where they disagreed and why. Stafford asked too many questions and then stopped asking questions at the wrong moment, and she had to calibrate that over the first 3 weeks. None of it was smooth. None of it was supposed to be. The first cohort arrived in November. 16 students, a mix she'd specified. 8 military, 8 civilian, all with emergency or trauma background, all considered high-performing in their respective environments. She stood in front of them on the first morning and looked at them, looking at her and thought about what to say, and what she said was, "At some point in your career, something is going to happen that you weren't trained for. Not because your training was insufficient, because the situation has moved past the edge of what any training program can anticipate." She let that sit for a moment. What we're doing here isn't filling in the gap. There is no filling in the gap. What we're doing is making you better at thinking when the gap opens under your feet. That's the whole curriculum. Everything else is how we practice that. A student in the third row, Air Force, mid-20s, the kind of attentiveness that reads as someone who came here specifically for this and is making sure to register everything, raised her hand. "What's the most important single thing?" she said. "Know where your exits are," Nora said, "and check your patient's drain output, in that order." The student, her name, Nora would learn, was Ferris, wrote it down, underlined it. This turned out to be characteristic. Well, Alcott called in December. She was at her desk at Fort Caldwell on a Tuesday afternoon, the fog gone by then, the ridgeline clear and sharp against a sky that had the flat, committed blue of a Virginia winter. She picked up when she saw the number. "How's the shoulder?" he said. His voice was stronger than it had been in the hospital. The hospital version of his voice had been a man managing pain with considerable practice. This version was closer to what she imagined his ordinary voice was. "Functional," she said. "How's the chest?" "They tell me the scar tissue softens," he said. "I've decided to believe them." "That's reasonable," she said. "I heard your first cohort is into week 4. Where did you hear that?" "Marsh sends me assessment reports." "Then why are you calling to ask about it?" A pause. "Because assessment reports are accurate, but they don't have any feeling in them," he said. "I wanted to know how it actually is." She looked out the window at the ridgeline. She thought about Ferris writing things down in the third row. She thought about Rourke running the Week 3 simulation, a mass casualty scenario, deliberately under-resourced, designed to force triage decisions that had no good answer, and making every call correctly, not because the calls were obvious, but because he'd stopped second-guessing at the decision point and started second-guessing afterward, which was the correct sequence. She thought about Okonkwo and Stafford in the debrief afterward, arguing about protocol in the specific, productive way of people who are both right about different parts of the same problem. "It's good," she said. "It's genuinely good." "I'm glad," he said. And then more quietly, "I owe you something I don't have the right language for." "You put my name in 8 months before Augusta," she said. "The accounting is already complicated. Let's not add to it." A silence that was comfortable rather than empty. "February they're saying for desk clearance," he said. "And after that?" "That's a longer conversation," he said, which is the polite way of saying probably not what it was before. She heard what was underneath that. Not self-pity, not bitterness, just the honest reckoning of a man who had done the math on what his body had been through and was learning to hold the result without fighting it. 40 years of service and 4 stars and a repaired vessel and a different kind of future than the one he'd assumed. "There are other ways to matter," she said. "I know," he said. "I'm working on believing that." "You'll get there," she said. "You're not built to stay stuck." "That might be the most generous thing you've said to me." Don't mistake it for a trend, she said. He laughed, a short, actual laugh, the kind that happens when something lands genuinely and the body responds before the mind has time to modulate it. And they said goodbye, and she put the phone down and sat for a moment in the afternoon light. The formal commendation arrived in January. It came in the mail, which surprised her. She had expected an email or a notification through official channels, but it was a physical document in a government envelope, and she opened it at her kitchen table in the small off-base house she'd rented in November. The language was formal and specific and described actions at Harmon Valley Medical Center in Augusta, Georgia, and the commendation was signed by Alcott and countersigned by Farron, and the language was precise in the way that institutional language is precise, which is to say, it captured the facts and left out the texture. She read it once, put it down, made coffee, came back and read it again. Then she folded it and put it in the box where she kept documents that mattered, on the shelf in the closet next to the box of books she hadn't fully unpacked yet, and she went back to the curriculum revision she'd been working on the night before. In February, a journalist published a report, cleared by naval intelligence, specific information only, names of the operators protected, locations undisclosed, about the Hess and Volk indictments, and the recovery of 4 service members listed as KYA. The report was careful and accurate and described a 7-year operation running through unauthorized channels that had falsified casualty records and arranged attempts on the life of the officer who uncovered it. It did not name Nora. One line near the end, she learned later, had been added at Alcott's specific request. The investigation was assisted by a member of the hospital staff who identified the threat before additional harm was done. That was all. That was the entirety of the public record of what she'd done. She read it on her phone in the Fort Caldwell parking lot on a cold February morning, and she stood there for a minute after she finished it and thought about what recognition actually was and what it wasn't, and arrived at something she'd been moving toward for a while without having the exact words for it. Being correctly seen by the people who had the information to see correctly was not nothing. It was, in fact, the thing. Everything else, the commendation, the reinstated rank, the offer, the line in a published report, those were the institutional gestures that pointed at the thing, but were not the thing itself. The thing itself was Alcott saying, "Who are you?" from a hospital gurney and meaning it as something other than a challenge. The thing itself was Sandra Obi handing her tape in a supply room without requiring an explanation. The thing itself was Farron saying, "You're the only person on this floor we're completely certain about," and meaning it as the highest available form of professional trust. She put her phone away and went inside to teach. The Week 4 field exercise ran on a Thursday in February, the first one that integrated all 16 students in a simultaneous scenario. She had designed it herself over 3 weeks, a simulated mass casualty event deliberately set in an environment that combined active threat elements with acute medical emergency, the kind of scenario that didn't occur in either pure combat medicine or pure trauma surgery, but occurred constantly in the real intersection of those things. She had built in 3 decision points where the right answer was not obvious, and 2 where the right answer was obvious, but the situational pressure made it feel wrong. She watched from a position where she could see everything and intervene in nothing. Ferris, the student from the 3rd row, the one who wrote things down, made the first critical call of the exercise incorrectly, caught her own error in 40 seconds without prompting, and corrected it. That was not in the rubric. The rubric accounted for correct calls and incorrect calls. It did not account for a student catching her own error in 40 seconds under active scenario pressure, because that was not a skill Nora had anticipated being able to build in 4 weeks. She made a note. Rourke ran his module without second-guessing at the decision point. He second-guessed in the debrief extensively and productively for 45 minutes. That was exactly the sequence. Okonkwo and Stafford disagreed during the exercise about triage priority on a simulated patient in real time, with 7 other things happening simultaneously, and they resolved it in under a minute and moved forward, and the resolution turned out to be a synthesis of both their positions that was better than either position alone. Nora had not taught them to do that. They had arrived at it themselves through the accumulated pressure of 4 weeks of working together in a space where neither of them could afford to be wrong alone. After the exercise, in the debrief, she looked at the 16 of them, tired, still running on the simulation's adrenaline, taking notes, or staring at the middle distance, or asking each other questions, and thought about what they represented. Not perfection. None of them were perfect. Ferris made errors. Rourke had almost missed a call in week 2 that would have cost him the simulation. The civilian ER nurse in the back row had a tendency to over-explain her decisions under pressure in a way that was costing her time she didn't have, and they were still working on it. The Army medic on the left had impulse control issues in high-stimulus environments that were improving but were not resolved. None of that was a problem. All of it was the work. The work was not producing people who didn't make mistakes. The work was producing people who kept thinking when they made mistakes, who caught their own errors in 40 seconds, who disagreed productively in real time and arrived at better answers than either of them had alone, who second-guessed after the decision point instead of during it. That was the whole thing. She had been told, 9 days into a job that was supposed to be small, that she wasn't qualified for trauma care. She had been suspended for interacting with a patient who trusted her when no one else could reach him. She had been accused, by a man lying on a floor, of being part of the operation she had stopped. She had been assessed as a threat by a vice admiral who had spent 40 years making himself impossible to assess, and she had walked into a room with him anyway and said the thing that needed to be said. None of that had happened because she was without flaws. She was full of flaws. A shoulder that ached in the cold, hands that sometimes shook, a sleep deficit she was still paying off in installments, an instinct towards self-effacement that had served her operationally and cost her personally in ways she was still calculating. She had made errors in Augusta, small ones, but real. She hadn't identified Hess quickly enough, had missed the signal of his specific interest in her background, had let 32 hours of sleep deprivation narrow her peripheral attention in the last hours when she could least afford it. The flaws were hers. The judgment was also hers. The difference between a person who is only their flaws and a person who acts in spite of them and through them, and sometimes because of them, that was not a quality you were given. It was a quality you built, over time, out of the specific material of the situations you didn't get to choose. She put on her scrubs on the morning of the week 5 exercise. Blue ones, the same color she'd worn at Harmon Valley, the same shade that meant nurse in the visual language of every hospital she'd ever worked in. She stood in front of the small mirror in her office and looked at herself for a moment, not examining, not assessing, just looking, the way you look at something familiar that you're seeing clearly. 34 years old, brown hair she kept pulled back, eyes that were gray in certain light, green in others. A face her mother had called forgettable, which she had always understood as a description of what she was built for rather than what she was worth. She had spent 11 years moving through rooms without triggering the part of people's attention that watched for arrivals. She had spent 22 months learning to be smaller than she was and finding it didn't fit. It had never fit. The 9 days at Harmon Valley had not taught her that. She had known it before Harmon Valley, in the abstract way you know things about yourself that you haven't yet been required to act on. Harmon Valley had simply been the situation that required the acting. She had a shoulder that ached in cold weather, and she had stopped pretending it didn't. She had hands that shook sometimes, less now than a year ago, and she had stopped measuring it obsessively, had stopped treating it as a verdict. She had a history that was classified in most of its specifics and complicated in all of its weight, and she had a program in a building at the edge of a Virginia ridgeline where 16 people were currently finishing breakfast and would be on the training field in 40 minutes expecting her to be there. She was going to be there. Outside the window, the fog was on the ridgeline, the morning fog that gathered in the fold of the land and held until late morning, the fog she had learned to use as a kind of clock, patient and reliable. By the time the exercise reached its critical decision points, it would be clear, good visibility, the kind of day where you could see what was coming. Not every day was like that. Most days weren't. Most days you made decisions inside the fog, without the visibility, without the clean sightlines, with information that was incomplete and time that was insufficient, and a body that had already done more than it had planned to. Most days you made the call anyway because someone needed you to make it. She had learned to make the call anyway. She opened the office door and walked out into the morning, and the fog was cold and close, and 16 students were heading to the training field, and somewhere in Virginia 4 recovered operators were going through their first weeks of medical evaluation, and in a federal holding facility in Washington, A vice admiral was working through his legal strategy, and in a hospital in Augusta, Georgia, a four-star admiral was 6 weeks post-op and learning what recovery looked like at a different pace than he'd lived everything else. And all of those things were true at once, layered and ongoing and unresolved in the way that real things are unresolved. She walked toward the field with her hands at her sides. She had never needed to announce herself. She had just needed to be there. She was.